Painkillers and antibiotics was one of the reasons my kidneys packed up.
There are so many medications that could destroy your kidneys. I'm going to be talking about 4 of those medications. Number 1 is a group of medication called NSAIDs. Now, ibuprofen, piroxicam, naproxen are good examples of NSAIDs. And people use NSAIDs for quite a lot of things. Anyone could be having headache, ibuprofen, menstrual pain, ibuprofen, knee joint pain, ibuprofen, without considering that taking too much could affect your kidneys. Now, there are some people who already have background kidney disease and they don't even know. Imagine them taking these medications that are toxic to the kidneys whilst having kidney disease. Tell me why you're taking metformin and you've not been able to keep food down for several days and you are still taking metformin. You've been unwell, you're having diarrhea and vomiting, yet your doctor didn't explain to you that if you're unwell and unable to eat, you shouldn't take metformin. It's a good medication if used properly with food, but without food, if you feel unwell at any point, you shouldn't be taking it. Now, the next group of medications are ARBs and ACE inhibitors. They are usually used to treat high blood pressure. Examples are candesartan, losartan, enalapril, captopril. Tell me why you've been started on any of those medications and you're not having regular kidney function tests. In fact, if you are starting any of those medication, if I was starting you on any of those medication, I'm going to be arranging a kidney function test 1 to 2 weeks after in order to check your kidney function. And before I even start you on those medication, I would have requested a kidney function test to have a baseline to compare it with 1 to 2 weeks after you've started using it. And if I see a rapid decline in your kidney function, I'm stopping it and I'm stopping it to an alternative blood pressure medication. And the last one that I reckon that most people are still using in Nigeria indiscriminately is gentamicin, a group of medication called aminoglycosides. And gentamicin is a notorious one that everybody, after surgery, they pop you on gentamicin. We don't do the levels back home. And then the next thing, you're still giving another second dose of gentamicin without checking the kidney function. So there was a patient we had who was previously in one of these Asian countries on holiday, and gentamicin destroyed his kidneys and also made him deaf because gentamicin could cause ototoxicity, which is damage to the ears, and it could also damage the kidneys. So this patient came back. So this patient came back with acute kidney injury on a background of chronic kidney disease. So they destroyed his kidneys while in that hospital, and he came back with a failed kidney, and he later passed away from it. So before you start any medication, before your doctor starts you on any medication, always check for the name of that medication on ChatGPT, put it on Google, put it on the internet, check the side effects if they are not walking you through the side effects, and check if there is any monitoring that needs to be done before you start swallowing and start popping those medications.